Antimicrobial resistance is a global health issue. However, most people have never heard about it and so may be confused or will not understand why it should be an issue. In this video, I'm going to share with you why you should be concerned about antimicrobial resistance. Welcome to my channel. If you're joining me for the first time, my name is Louisa. This is a learning channel, and so after watching this video, you should know what antimicrobial resistance is, what antibiotic resistance is, and you know the difference between the two in a bit. You should also know what accelerates the emergence and spread of antibiotic resistance, and then I'll take you through some research findings on antibiotic resistance in Ghana. After that, I will tell you why you should care about antibiotic resistance, and finally, what is required of you as an individual to help prevent and control antibiotic resistance. So what is antimicrobial resistance? According to the World Health Organization, which is the lead agency in international health, antimicrobial resistance happens when microorganisms such as bacteria, fungi, viruses, and parasites change when they are exposed to antimicrobial drugs, and as a result, they become ineffective in the treatment of infections. And what that means is when you fall sick and you take those drugs, they no longer work for you. In the definition, we can see antibiotics, antifungals, antivirals, antimalarials, and antihelmintics. These are drugs that are used in treating one of the microbial groups above. For example, antibiotic is used to treat bacterial infections. Antifungal is used to treat fungal infections. Antiviral is used to treat viral infections. And antimalarials and antihelmintics are used to treat parasitic infection. And so antibiotic resistance will mean when antibiotics become ineffective in the treatment of bacterial infections. And we know some of the common antibiotics, right? Like ampicillin, penicillin, amoxicillin, ciprofloxacin, and others. I remember when I was much younger, whenever I get a cut, my mom will apply the contents of amoxicillin, what we often refer to as a bone belt in Ghana, onto the wound, or even sometimes apply penicillin ointment. And so those are the kinds of drugs that I'm referring to. Now we know that an antibiotic is just one group of antimicrobial, and this video is going to focus on antibiotic resistance. It is possible that a bacterium is singular and bacteria is plural. So it is possible that a bacterium may show resistance to more than one antibiotic. And when this happens, it is said to be multi-drug resistance. So what then accelerates the emergence and spread of antibiotic resistance? Over time, bacteria becomes resistant to antibiotics naturally, often through genetic changes. However, the misuse and overuse of antibiotics in humans and animals is known to be accelerating the process of antimicrobial resistance. And this is how it happens. I'm going to give you 5 ways in no particular order. First one is when we take antibiotics without prescription. We may take a dosage which is less than what is required to kill the bacteria, and as a result, the bacteria survives, adapts, and becomes resistant. The second one is when we do not complete the course when we are prescribed antibiotics. And for some people, as soon as they start feeling better, they abandon the drugs. The third one is when we give our leftover antibiotics to others. And the fourth one is when we use antibiotics to treat infections like colds and flus. Antibiotics are used in the treatment of bacterial infections, and so stop using them to treat colds and flus, especially in this era of COVID-19. The fifth one is overuse of antibiotics in farming. In animal production, antibiotics are used to prevent infections and also as growth promoters. I'll do a separate video on the use of antibiotics in animal production. Let's narrow down to Ghana. In response to the global action on antimicrobial resistance, Ghana launched its antimicrobial use and resistance policy and the accompanying National Action Plan in April 2018, so we are almost 3 years gone. The policy is the guideline or regulation on antimicrobial use and resistance, and the action plan is the steps or actions that will be taken to achieve the policy. Several researches have been done on antimicrobial resistance in Ghana. Let's look at a few of them that were done before the launch of the antimicrobial use and resistance policy. This study looked at resistance to antimicrobial drugs in Ghana. They took samples from the Kolebu Teaching Hospital, Komfuanochi Teaching Hospital, 7 regional hospitals, and 2 district hospitals. Their findings revealed high resistance to some common antibiotics. The worst of it was the observation of multi-drug resistance. Another study looked at the prevalence and pattern of antibiotic resistance, Staphylococcus aureus, isolated from door handles and other points of contact in public hospitals in Ghana. Staphylococcus is a type of bacteria. From their experiment, they found Staphylococcus on door handles and other points. Some showed resistance to at least one antibiotic, and some were multi-drug resistant. Let's look at another study. This study examined multi-drug resistant bacterial infections in a teaching hospital. They observed high resistance to some of the antibiotics and an average multi-drug resistance of 89.5%. That was very high. All the 3 studies that we've looked at stated overuse and misuse of antibiotic as causes for the emergence and spread of antibiotic resistance. This study did a situational analysis of antibiotic use and resistance in Ghana and concluded that the absence of a national antimicrobial policy, weak regulatory environment, and non-adherence to practice standards may have contributed to the development of antimicrobial resistance in Ghana. Now let's look at another study which was conducted after the launch of the antimicrobial use and resistance policy. The study found that although Ghana has laws to regulate the sale of antibiotics, enforcement has been a major challenge. See some interesting statements from respondents in this study. I don't abuse antibiotics because I know the implications. If everybody were to know, it will reduce the problem to a large extent. But people are doing it out of ignorance, and people think if you have a cold, you take, let's say, Septrin, which is a very basic one. 2 to 3 days, you get some relief and throw the rest away. This is from another respondent. Well, most of us don't take our medications. That's one. We don't understand I mean, it is with the study of microbiology that perhaps we understand that the fact that you are feeling better does not mean the condition is resolved, and the general public does not know that. For instance, the most common drug, pain relievers, we tell them that when you feel better, stop. So it's easy for them to transfer that to whatever they are taking. Interesting, isn't it? Let's look at this one. Then, of course, there are also times when prescribers are not prescribing according to guidelines. So instead of taking the first line of treatment, you think that the person can afford a stronger medication, and you feel that you don't want to inconvenience the person because the person may go and not feel well and has to come back and do the test. So they just go to the second line or third generation antibiotics. When you analyze the results, you realize that initially the problem was because we did not have a policy. But now that we have a policy, the challenge here is enforcement. This is the point where I tell you why you should be concerned about antibiotic resistance. And I'm going to give you 3 reasons. 1, if we do not stop the emergence and spread of antibiotic resistance, then it will get to a point where it will be very difficult to treat infections, even the common ones. And this may result in high cost of healthcare and lengthier stays in hospitals. 2, medical procedures such as surgery, which require opening up the human body for a longer period of time, become very high risk without effective antimicrobials. And what this means is people will dread having surgeries because the drugs that will be given to them after these surgeries may not work for them. 3, it is very hard and expensive to develop a new class of antibiotic. In fact, the last one was introduced in 1987, and since then, there hasn't been another. And so it is very important that we don't take these drugs for granted. This is what the WHO recommends individuals to do to prevent and control antibiotic resistance. Only use antibiotics when prescribed by a certified health professional. Never demand antibiotics if your health worker says you don't need them. Always follow your health worker's advice when using antibiotics. Never share or use leftover antibiotics. Prevent infections by regularly washing your hands, preparing food hygienically, avoiding close contact with sick people, practicing safer sex, and keeping vaccinations up to date. Did you hear about antimicrobial resistance before watching this video? Let me know in the comment section below, and also share your experiences about the topic. Hope you enjoyed this video. Be sure to subscribe for more content and give this video a thumbs up. Share with your family, friends, and colleagues. Everyone needs to hear this message.